Bismillahirrahmanirrahim. Welcome to my third lecture. So in this lecture we will discuss about the mechanism of action of analgesics, especially non-steroidal anti-inflammatory drug or non-opioids analgesics. So these drugs are responsible to inhibit the production of prostaglandins. These drugs are responsible to inhibit the production or synthesis of prostaglandins. So prostaglandin, these are actually those chemical substances which are responsible for the inflammations. So in order to reduce the inflammatory rates, these drugs may directly inhibit the production of the prostaglandin. Aspirin and Nsaids non-steroidal anti-inflammatory drugs appear to share a similar molecular mechanism of action, namely inhibition of synthesis of prostaglandins, which are the natural products of inflamed white blood cells. Prostaglandins are the natural products of inflamed white blood cells, and these prostaglandins, they induce the responses in local tissue that include pain and inflammations. In fact, aspirin and all aspirin-like analgesic, including indomethacin and sonidec, which are derived from an heterocyclic organic compound known as indole, inhibit the production, synthesis and release. Further, we will divide these agents into two groups. So all these agents, they can be further divided into two groups. The first one is called non-selective COX inhibitor and the second one is selective COX inhibitors. Now what are COX or cyclooxygenase? As the name indicates, COX or cyclooxygenase is an enzyme responsible for the production or synthesis of prostaglandin and related compounds. Forms of cyclooxygenase, it is two forms, COX-I inhibitors and COX-II inhibitor. So COX-I cyclooxygenase 1, which is found in most normal tissues. The normal tissues, COX-I, they are found everywhere, especially in your normal tissue, not in abnormal tissue. COX-II, which is induced in the presence of inflammation. Whenever there is certain type of inflammatory reaction occurs, so it will be induced, because COX-II, they are not normally expressed in the stomach, because there are certain prostaglandin which are also produced by the stomach. Now what are the advantages of COX-II inhibitor? The use of COX-II inhibitors, for example, Neproxen and Celecoxib, these are COX-II inhibitors, seems to result in less gastric ulceration that occurs with other anti-inflammatory analgesics, particularly aspirins. However, COX-II inhibitors do not reduce the ability of platelet to form clot. It means that COX-II inhibitors, they do not reduce the ability of platelets to form clot, a benefit associated with aspirin and other non-selective COX inhibitors. Now in comparisons, if we compare the COX-I and COX-II inhibitors with Nsaids, preferences in COX selectivity and the possibility of additional molecular action of Nsaids may explain differences in the therapeutic effect between aspirin, acetaminophen and Nsaids. For example, aspirin is effective in reducing fevers, meaning it has strong activity against fevers as well as relieving inflammations, while acetaminophen and Nsaids, they are more potent antipyretics and fever reducing analgesics. Acetaminophen, on the other hand, possessed inferior anti-inflammatory activity as compared to aspirin and Nsaids. So what does it mean? That acetaminophen, it has strong analgesic activity, but its anti-inflammatory activity is lower than if it is compared with the aspirin and Nsaids.